Yeah, so hello everyone and welcome. While we're waiting here, today's call is going to be recorded, or is currently being recorded. We still would encourage you to turn on your video and ask questions as when asked. We've also got this as a meeting rather than as a webinar, so that we can actually enable people to be active. So feel free to make use of that. But when not asking brilliant questions, please mute yourself or make sure that you have a quiet space. And you can, if I have muted you, you can unmute yourself, but
Is it better?
while we wait, as people are still dropping in, I will make a small advertisement for the AMR conference. So the AMR conference will be happening on the 6th to 7th of March here in Basel, which is an annual conference. It's now, I think, the third time we will be in Basel. This is a real chance to meet the European and relatively global AMR community. And with INCATE, we're very happy to get involved each year, and we run a poster and a pitching session. So a poster session, which we do together with NCC Anti-Resist, and actually that's sort of a chance for you to present posters. And the pitching session, where that's a pitching session on the first evening, is a chance for you to stand up and get to win 10,000 euros, which is voted on actually by the audience. So it's a chance to get some feedback on your venture. And our first person, actually, the first venture that won that prize was Limitech Biologics, and they just closed a funding round for 37 million. So I don't think we were the only reason, but you know, it can't hurt. So if you want to hear when the poster and pitching sessions will be open, sign up to our newsletter. The QR code there will also take you to the AMR conference, so you can see a bit more there, what's going on. We'll just have a look at the number of participants that we have coming in. All right, let's get started, I think. The first bit is I will, first of all, introduce myself. Douglas Hagstrom is my name. I'm part of the INCATE management team, and I'm responsible for community and partnerships, and we'll be hosting today's webinar. As I said, it is a webinar, but you're all here as participants. So at the right time, you know, feel free to unmute and ask a question, and definitely at any time, put any questions you have in the chat. So I'll give you a brief update for those of you who don't know about INCATE. INCATE stands for the Incubator for Antibiotic Therapies Europe. And our goal is really to help innovators like yourselves on the call to bridge the gap from research to becoming investable companies. We know that there's great ideas in universities and other research institutions, but we also know it's very hard to get from there over to industry. And we try and help to bridge that gap by providing advice, community, and funding. And who we are is a partnership. So we have now 5 members. So these are mainly academic institutions, but we've now been joined by BioAster, which is a technology institute in France. And we organize and run INCATE. And then we have industry partners who are bringing their industry experience, and also they fund the non-dilutive fund that we're able to give out and support ventures. But as important as the funding is, they're actually actively involved in the selection and support of companies, which is really, I think, how we differentiate ourselves. And that's how we're having the biggest impact. We also have supporting partners who've spread the word about today, and also can provide advice to each of you individually. The management team is made up of these 9 people. We're here to help. We really do want to see you succeed and move across that bridge and become investable. Please get in contact, and we look forward to meeting you at the AMR conference and in other places as you develop. This is probably the most important slide from our perspective. We have a portfolio of 29 ventures that we've selected at stage 1 and that we're actively supporting. And there's 5 more that are coming. And that's really what we've been doing. So we launched a couple of years ago and are really focusing on how can we find, select, and support companies and move them forward. And these are our portfolio as it stands today. And as you see there, we have both direct-acting antibiotics and also some other alternative types of therapies. We don't have diagnostics yet. Coming in the future, we'll work on that. If you have an interesting innovation, we'd like to hear from you and see how we can help. The question of what today's about, which is the Entrepreneurs Club, we knew that not only did we want to provide advice to each of you individually, but we wanted to help to build a community when we started INCATE. And the Entrepreneurs Club is part of that. So I'll be handing over to an entrepreneur soon to lead the conversation, but it's really about us answering sort of the questions that you have and seeing how we can support. So the first one we did was we had Mark Gitzing, an entrepreneur. We then met some of the equity investors. And then actually we were listening and sort of thinking, what do people actually need today? And we did an interview with our stage 1 companies and asked them, how are they going? What's happening right now? And we asked a couple of questions around funding and some more general things as well. And in terms of funding, the first thing you see, the runway, most of the companies that we're working with are gonna run out of money, in a year and a half. And when they look forward, they also need to raise a couple of million to support themselves going forward. And when they think about INCATE, like the quote there is what I think reflects it, which is, hey, INCATE can help, but we actually need more funding opportunities. And we know there's a funding gap, and that's actually sort of the idea of INCATE. And this is an old slide which we're sort of updating, but this is how we've thought about ourselves. We know that there's these research and concept validation, and there's some money there, and we know there's a gap in between. And INCATE is sort of there in the middle, seeing how we can help. And we also know from the comment you said before, like, we can't do this alone. INCATE isn't enough. And actually, we've stolen this slide from GARD-P and added a few things to it. But this is really what we're talking about today. We're having a look at this funding landscape and where do we fit into it. And today, we're going to be focusing here, which is really who can help around INCATE and a bit forward and a little bit back, and how can they help. And we've got representatives that from across that sort of square that Remco will introduce. But I'll sort of shut up now. Happy to answer questions, obviously, either in the chat or afterwards. But I'd like to hand over to Remco van Leeuwen, who is our entrepreneur today, to first of all introduce himself and then lead us through the conversation today.
Thank you, Doug, and let me start by thanking you for inviting me to moderate the rest of this session. I'm really excited doing that. I think it's an important topic that we're going to discuss the next 1 hour and 20 minutes or so. And so I really think it's great that you took the initiative to organize this webinar. You already showed some figures that actually also show a problem that I recognize from my own experience. That is, if you start a company, the runway that you're typically looking at is relatively short. So I think that the numbers speak for itself. And what I did some thought what I would actually tell you as an audience as an introduction, and I thought, well, let's stick to some own experience. And so first, I'm founder and CEO of now 2 companies. I founded 10 years ago a company that worked on the development of direct-acting antimicrobials called Latham Therapeutics. That was a bumpy road that, unfortunately, due to the difficult market circumstances around antimicrobial, the antimicrobial market didn't end well. This year we started a new adventure, which is Survivix. We are one of the companies that is incubated in stage 1 of INCATE. And in Survivix, we are working on a product that we hope and believe can improve the survival of patients with sepsis. So a very important unmet medical need, and we think that we have a solution that can make a difference there. Now, when I started my first company, I must say in retrospect, maybe a bit naive, although if you look at the figures of the market circumstances 10 years ago, they were actually a lot better than they are nowadays. So when I started the company, the last multi-billion dollar deal in the antimicrobial space was actually done between Merck and Cubist at the time for $9 billion US, and that's a figure that we haven't seen since. When I started talking to investors to get the first seed funding and Series A funding into the previous company, and consistently heard, well, this is a big unmet medical need, but we're as investors are not ready to invest in this. The first couple of years, I thought it was maybe a lack of my own convincing capabilities and talents to talk to investors. But when I consistently got the same story from investors, I quickly realized that it's actually the market circumstances we need to improve. And hence I joined the board of the BEAM Alliance. The BEAM Alliance is an association of biotech companies in Europe that work on antimicrobial drugs and antimicrobial diagnostics. We have over 70 members. And all of these members actually are in the same stage. That is, sometimes you can find some funding through your own network. Sometimes there are some national grants, but it's very difficult to get your company funded beyond early preclinical work. The BEAM Alliance is actually lobbying very hard for changing the market circumstances, and that's, I think, the most important thing we can do. Because actually the problem is very simple if you think about it. Because the difficult market and the lack of an appropriate reimbursement for antimicrobials, there's no pharma that is actually active in the field. Yes, of course, there is the AMR Action Fund, which you also will hear more about. But there needs to be better reimbursement models for pharma to really get back into the field. And if pharma gets back into the field, then investors will get back in the field, and it will be a lot easier for us to attract funding. We're not there yet, and therefore it's very important that we have this early non-dilutive and dilutive funding opportunities. And like Doug mentioned, we're actually highlighting a few of them. So today you will hear a couple of talks about funding opportunities where you can get in-kind support. You will hear some talks about US funding opportunities, which I think for, I'm not sure who's in the audience, but assuming that most of the people attending are residing somewhere in Europe, is always, I think, a nice thing to hear, because we typically are somewhat better connected to the European funding opportunities than the US funding opportunities. So it's very nice to to have those talks here at the webinar. With that introduction, I would like to start introducing our first speaker. Our first speaker is Aaron Setuni. Aaron is Preclinical Service Project Manager at the National Institute for Allergy and Infectious Diseases, NIAID, and she will tell more about what you can expect from NIAID and from the NIH. So Aaron, the floor is yours.
Thank you, Remco. So I'm going to pull up my slides. Hopefully this will work smoothly. And while I'm pulling them up, I want to thank the organizers for this opportunity to tell you all about the funding and support opportunities at the Division of Microbiology and Infectious Diseases, which is part of NIAID for product development. So just to make sure we're all on the same page, a reminder to the audience that the National Institute of Health is the United States Medical Research Agency. And within the NIH, the National Institute of Allergy and Infectious Diseases is charged with conducting and supporting basic and applied research to better understand, treat, and ultimately prevent infectious, immunologic, and allergic diseases. NIAID's budget in fiscal year 2023 was approximately $6.6 billion US. Within NIAID, the Division of Microbiology and Infectious Diseases, or DMID, has a broad mandate spanning research for over 200 human pathogens, with the exception of HIV, which has its own division within NIAID. DMID has multiple priority areas, which are listed on this slide, and that includes antimicrobial resistance, which I know is of particular interest to this audience. So DMID's support for anti-infective product development spans this full product development arrow, as Douglas was mentioning in his introduction. So all the way from basic research through to clinical development. And folks in the audience are going to be most familiar with NIAID's grant and contract funding mechanisms, which are shown in the yellow arrows here on the chart. And they are the main drivers of NIAID's support for product development efforts. But today I'd like to ensure that the audience is aware that DMID also provides free services and resources to research and development communities. So those are shown in the green arrows here, and they include our resources for researchers, such as 3D protein structure characterization, access to reagents and isolates, and chemistry support, as well as our preclinical services and our clinical services. And today, in the interest of time, I will be focusing on our direct funding support mechanisms and our preclinical services program. So NIAID funding opportunities supporting product development provide direct, non-dilutive funding to investigators at academic institutions and companies worldwide. For more information, including contact information for our program staff, please visit NIAID's Find a Funding Opportunity webpage, and that'll provide you the link to our contact information. So throughout the year, certain investigator-initiated funding opportunities have 3 standing deadlines every year. However, NIAID also releases periodic funding targeting specific research interests, and they will have unique deadlines and deliverables. And so I'm going to encourage you to sign up for NIAID's funding news so you don't miss any new opportunities as they arrive, and this will send those opportunities directly to your inbox. So shifting gears for the remainder of my talk, I'd like to introduce you all to NIAID's Preclinical Services Program. Preclinical Services utilizes a suite of contracts to provide support for anti-infective product development. These are free gap-filling services intended to lower risk and move programs forward in the product development pathway. The goal of these services is to keep promising products moving forward and avoid program stalling due to intermittent gaps in funding or access to resources. Innovators from academia, nonprofit organizations, industry, and governments are all eligible to apply for these free services. Both domestic and foreign institutions may apply, and you don't need to have NIH funding. Because preclinical services are intended to quickly fill discrete gaps in product development programs and keep them moving forward, there's a simplified request process that's open year-round. And that process starts with an email to the contacts at NIAID who are involved with the target indication or pathogens of your program. And you can find those contacts at the link provided at the bottom of that slide and at the bottom of this slide. So the scope of our preclinical services is quite broad, with capabilities in synthesis and manufacturing, in vitro and in vivo efficacy assessments, non-clinical safety, and pharmacokinetics that can all support vaccine or therapeutic programs. New this summer, we also offer diagnostic services to diagnostics products. If you would like to hear more about these free gap-filling services, please reach out to the NIAID program staff to discuss your product and your program and find potential alignments with our service opportunities. And so that was a very quick, but I hope helpful introduction to the various mechanisms that DMID is leveraging to support infectious diseases product development. There is a wealth of information available to the public on our websites, and I encourage you to check them out. I'm also excited to announce that at the end of this month, DMID is launching a new webpage specific to product development support activities to help guide product developers to find the best place to reach us. I welcome you to reach out to me if you have any questions, and my email is up here in the top corner of the slide, and I hope to hear from you soon. Thank you.
So Erin, thanks a lot for staying within time. I realized that before introducing you, I haven't really discussed with the audience the format of how we are going to do things. So you may have noticed by now that we have asked the speakers to really give a short pitch. We have, after each presentation, about 5 minutes for questions and answers. If you have questions, please put them in the chat. I saw that Doug already put a link to the different programs that are listed here in this conclusion slide in the chat. So you're invited to visit those links. Erin, while we're waiting for people to come up with their questions, you offer free services, which is obviously great. Question is, is there any caveat there? For example, what do you do with IP rights?
Sure, that is a very common question. So before any services can be received by an institution, we will execute a non-clinical evaluation agreement, which will lay out the terms of the service and any questions about IP rights. So everyone who would access these services would be engaging in that agreement and aware of their rights. But just briefly, we do not have IP reach. The IP remains at the institution, and the information that is gained from these services, the data and any materials that are derived from the services belong to the investigator who's requesting them.
Thank you, Erin. That's very clear. I don't see any additional questions for you in the chat yet. We will have a panel discussion after all the 5 presenters. So if you do have questions for Erin and you want to have them answered during this webinar, you still have the opportunity to raise your questions in the chat, and we can try to address them during the panel discussion. So I would like to introduce the second speaker to this webinar. The second speaker is Cassidy Kentin from Latham Bio. Cassidy, you have a look at your resume. You're a person that is very active for a long time in the life science industry. You have a lot of experience with non-dilutive funding in various roles. So I'm very excited to hear from you your sort of take on the US funding landscape, and also how with Latham Bio you could potentially help companies in being successful in applying for US grants. Cassidy, the floor is yours.
Perfect. Thank you so much. Well, I am very good at helping find non-dilutive funding and helping, I navigate some of that space. I do become very technologically challenged, especially when it comes to Zoom. So let's see if we can do this effectively. All right. Can you guys see my slides?
Yeah, we see it.
Yes.
Yeah.
Okay. Oh, well, we got to do the little switchy thing. It doesn't like to do this on my computer with Zoom, so please bear with me here. It's not here.
I think, Aaron, it's fine if you just go in this presentation mode, then we can see.
No, it went away. So we're just going to go in this mode, guys. I do apologize. We will work through my technical difficulties here. So let's talk about who Latham BioPharm Group is. Let's try this one more time. We are a life science consulting firm. We are a full service life science consulting firm. So we help with our clients with multiple different areas. I lead our non-dilutive funding group. We also have strategic consulting, which is where we help our clients do everything you would think a management consulting firm would do. We help with things like understanding your voice of customer, what the market landscape is, et cetera. We also have a product development arm. So kind of in line with what Aaron was talking about and helping people kind of actually execute upon some of your preclinical services. We help our clients navigate through that space. And we are actually one of the IDIQ awardees under a NIAID preclinical services agreement that helps either NIAID preclinical services awardees or our clients with everything from early stage discovery all the way through to about phase 3. I know the NIAID preclinical services window is smaller than that breadth, but we help with kind of everything in between. So we have a number of people on staff, everyone from toxicologists to regulatory staff members, to be able to help clients navigate, the product development pathway. LBG actually was purchased last year by a large French consulting firm called Sia Partners. We were purchased because of the fact that we were a life science consulting arm and to help them expand their US presence because of all of the great opportunity and companies and non-dilutive funding opportunities within the US. What is really cool about our relationship with Sia is that while they are a large consulting firm, we still operate as a smaller business and subunit underneath them. This slide just talks about our record of success. As you guys can see here, we've worked with a number of different agencies, and we've helped our clients navigate, secure, and manage almost $3.5 billion in non-dilutive funding since 2015. That is not just one very large $2.5 or $3 billion COVID contract. A lot of those did happen, and while we did help people in the COVID space, our sweet spot really happens to be with clients in that $10 to $100 million range in funding. Like I said before, we've actually recently also been awarded the NIAID preclinical services contract for biopharmaceutical development. I think it's relevant to this call as, we will help clients through that space. We obviously, to Aaron's previous point, we are not part of the selection process, but we are part of the execution. And one of the things that we really kind of have brought to the table to this and being able to help both our clients and hopefully NIAID as stakeholders is to look at as you guys can imagine, there's a breadth of landscapes. So bringing a broad sector of CDMO and other partners to the table to help execute upon your problems or program. This is how LBG helps our clients. So we help our clients doing things like landscape assessments. Aaron talked about a breadth and a number of different opportunities. We help our clients figure out which ones are relevant for them. I think a lot of times, and especially in today's capital markets and kind of, economic futures, companies are really excited about non-dilutive funding, but sometimes, non-dilutive funding is not for the faint of heart. And it's not just ooh, cool, the government's going to give me $2 million to do whatever I want. No, there's a lot more to it than just a quote unquote, way to kind of keep the lights on. There's some more strategy involved. If you take on a government contract, you are committing to that work. I really wish to say, and I think Aaron would probably feel this way too, that if you get you start looking for non-dilutive funding, it is a process. So you don't get to turn on the light switch and say, look, we want non-dilutive funding. And all of a sudden, you're under agreement with NIAID within 30 days. So we work really hard to have our clients understand what the landscape looks like and look at opportunities outside of just the NIH. Maybe there's opportunities within the DoD or, the other Aaron talks about CEPI or Wellcome Trust or the Gates Foundation. There's lots of different opportunities that exist out there, and we help our clients understand what that looks like. The agencies are also designed to fund different things. It does not work for anyone's best interest if U.S. government agencies were fighting over different, funding different types of funding. So NIH typically will fund, or NIAID will typically fund up to a phase 1, whereas BARDA will come in and fund from a little bit into phase 1. Through to commercialization. So we help our clients kind of understand what those landscape looks like, what the different technical readiness levels are that are required. and kind of just understanding how you go about pursuing it. Then we help you to strategically position yourself and do outreach. We help you get on the phone with people like Aaron to make sure that you are aligned with their expectations, that what your problem or your solution is solving what the government is currently asking for in their problem. And then we do things like opportunity response. So if any of you have ever gotten a grant or a contract, they don't make it easy for you. It's not a 3-page abstract and you turn around and here's your proposal, here's your contract. There's a lot of fine print. There's a lot of compliance requirements. And things we hate seeing is that people get rejected from a grant or a contract opportunity because they forgot to check a box or because they weren't compliant in a certain section. So we really help our clients think through what their strategy is, how they respond, and making sure they are compliant and that their response is holistic. We're recently working with a client who didn't put in any direct funding for one of their UO1 grants because they didn't know that they could. So we really help you understand what you can and cannot do within the confines of government funding. Then once we help you, we get there, we say, okay, the government has said this is great. We appreciate what you've submitted, and we help you negotiate your contract with the US government. It's a little different than typical business-to-business contracting. I think everyone wants you to be successful and win. Just sometimes government has different rules and requirements that, they are not flexible on. And so helping you kind of reformat or redo the things that you need to do through that contract negotiation. And then we always call, the contract execution, the contract and technical execution. You become the dog that caught the car. You have gone through a huge ordeal, probably 12 months minimum. And now you have this contract. And what are you going to do? So not only do you have to technically deliver on the contract, so all the stuff that we've talked about with the government and we proposed, but there's also other requirements from both a financial compliance, program management, and contractual requirements. So we help you navigate all of that landscape. Next slide. So beyond kind of our project management and compliance, LBG has product development experience that we really help our clients with. So this is all the way from early stage discovery, CMC, preclinical or non-clinical, depending on who you talk to, clinical and regulatory, quality and business processes. One of the things right now with SBIRs that's really exciting is they've brought back TABA funding, which I get the acronym wrong all the time. I think it's Technical and Business Assistance Program. And that offers SBIR grant recipients additional funds to do commercial-like activities, anything from IP assessments, market research, business development plans. And it's just a box that you have to check during the SBIR process with a small summary of what you're going to do with those funds and how you're going to outsource them. A lot of people don't know about that. And that's a really great service that we can it's a quick conversation to check that box to help push forward your program. I think I'm at time. So I think this is the last thing. If you have any other questions, this is my contact information, and I am more than happy to answer questions now or at the end of the presentation.
Thank you, Cassidy. Also, thanks for staying on time. Again, if you have questions to Cassidy, you can post them in the chat. While we're waiting for that, Cassidy, I was actually thinking while you did your presentation, suppose that you're a young entrepreneur and you have seen this, this great NIH opportunity in R21, for example. On what business terms are you working with that entrepreneur?
So I think that's what's really awesome about us still kind of being a small company. We can be flexible with how we work with our companies. However, the one thing I have learned is anytime you give anything away for free, no one values it. So, we are a fee-for-service organization. I do appreciate things like being able to cash my paycheck. So we don't operate on, we're not a free resource, but we can work with companies in making sure that it is a value add to them. Our goal is not to, when you're looking for funds, you don't always have a ton of funds. So we can structure things that make sense for both our organization and our clients. So I think your question also answers Sven's. That worked out very well. You preempted the question.
Can you give a hint on, what sort of do you have a monthly retainer? How big is the monthly retainer, or does that vary?
So we don't work on a monthly retainer. Okay. And everything is really specific. Every client, every product, every program is different. And we know that. And so we treat it as such.
Okay. Thank you so much. Again, if you have any additional questions for Cassidy, we will have a panel discussion at the end. So you're more than welcome to submit questions in the chat, and then we can see whether they can be answered later. Thank you, Cassidy, for your contribution. We go for the third speaker in the program. You may have seen an announcement that Anders Kellen, who's the coordinator of Enable2, would actually give this presentation. Doug and I got an email from Anders this afternoon that he actually was stuck en route back to Sweden. So he sent an email from Frankfurt Airport saying that he probably couldn't make it. We're very happy that the co-coordinator of Enable, Duramet, and I'm not sure whether I pronounce your surname right, but I'm going to give it a try. Yuche is able to stand in for Anders, and Duramet is a co-coordinator of Enable and also professor at the Department of Medical Biochemistry and Microbiology at Uppsala University in Sweden. So Duramet, the floor is yours.
Thank you, Remke. Get my screen up. Okay. Can everybody see this? I hope you can.
Yes.
Yes, great. Okay.
You just need to swap your displays, Diarmaid. So just click the swap displays button at the top there.
Yeah. Perfect. Thank you. Okay, so firstly, the name Enable2. So many of you may be aware that the IMI had a new drugs for bad bugs program running through most of the teens. And so Enable was part of that from 2014 to 21. And when it ended, we had this idea that it would be a pity to let the expertise simply dissipate and disappear. And we succeeded in persuading the Swedish government to fund a slimmed down version of Enable to help with drug discovery, early stage drug discovery. And that's what Enable2 is. Now, in this slide, you can see where we're positioned. We have a limited amount of money. And so we decided to position ourselves at the hit to lead stage, somewhere into lead optimization. The idea was to help groups develop strong leads, which could potentially then be taken up in other funding initiatives, for example, CARB-X or pharma, if they were interested in getting into the area. The bacteria we primarily work on are the ones at the top of the WHO and CDC priority list. So Enterobacteriaceae, Pseudomonas, Acinetobacter, Staph aureus, Enterococcus faecium, and so on. This slide and I apologize, I have a cold as well, so it's not just that Anders is missing, but my voice may also disappear at some stage. But this slide shows the way the organization is set up. We have now continuous open calls, so anybody can make a very short, non-confidential application, which will be reviewed by independent reviewers to see whether it's appropriate for Enable2. Every few months, we have a meeting of a portfolio management committee who actually decide whether or not, based on the confidential data that they see, whether a program is eligible and should be asked or given the chance to enter. And if they enter, they will become part of the drug development platform. And I'll tell you a little on the following slides how that works. So firstly, an important point. The hit owner coming in will retain all of the intellectual property and all of the data generated. So you've heard this earlier with the NIAID. So everything that is generated stays with the hit owner. The hit owner also establishes a partnership with the experts within Enable2. So we basically form a development team together. We provide resources. We like them to provide whatever resources they can. We develop a plan together. We carry out assays. We provide expert advice. And we give them access to a variety of experts in different scientific areas and also with a lot of experience in the industry to help drive the program forward. So it's a mixture of advice and actually carrying out assays for the hit owner. This is non-confidential because it's on our website at the moment. These are the current programs in the portfolio. You can, some of them will mean something to you, others not. But basically, we are focused on direct acting antibiotics with the potential for systemic activity. That's the key issue. And to get in the first place, they have to have antibacterial activity. They have to have known structures for the compounds. It's a fairly low bar to get in, but direct acting and systemic are the key issues. If people are, and I'm going to tell you in a moment about a big caveat. If people are interested, this is the web address to send a non-confidential document indicating some details about your program. These will be evaluated on a continuous basis. But the caveat, because we have funding from the Swedish government, we are only providing help to academic groups. We are not allowed by state aid rules to provide help to private companies. So I realize for this audience, that's a major caveat. We are currently in negotiations with other potential funders because we also realize that this is a major limitation on our ability to help advance the field. But for the moment, it's only academics at private or at publicly funded universities. So our funding as of now runs to the end of 2027 with the Swedish government. As I say, we're working on a more long-term solution, which will hopefully allow us to help SMEs. There is absolutely no cost to academic groups entering. So the advice, the practical help, etc., is free, and they maintain ownership of everything. And yeah, that's basically it. So here again, a couple of links if people are interested to make an expression of interest, or if they simply want to ask for more details about how this works in practice.
Thank you, Duamar. You have one question that came in from Nikolai over the chat. The question is, are you only focused on small molecule drugs?
No. I mean, if by that you mean, are we not focused on natural products? Yeah, natural products, small molecules, combinations. The key is we're focused on direct acting drugs. So we're not working with antivirulants, but, you know, beta-lactamase inhibitor combinations, big natural products, anything like that is open to us. Yeah.
Okay. Another question from Erin, actually. Erin said to me, who you heard earlier, is, are there any geographic restrictions to your funding?
Legally, no, but for practical purposes, we spent the first year limiting ourselves to Sweden just to get up and running. And at the end of that first year, we decided to open up across all of Europe. And that list of current programs I showed you, I think they're from 4 or 5 different countries in Europe. So, and there is no legal reason why we couldn't open up to the US or to Asia or wherever, but it's just a practical issue of we're learning how to manage this, and we're a fairly small group with limited funding. So.
Right. Question that came up in my mind is that, you know, some of us have close friends with academic collaborators. You know, so you might imagine that if you cannot apply as an SME, you might apply from the academic side. Is there any restriction, you know, in terms of transfer later of the IP from the academic side to the SME, or is there no sort of policy for that?
No, I mean, potentially that's a difficult legal question, but in principle, no. If you come in as an academic, we will do our best to help you develop. And then if you subsequently want to set up a company or sell whatever you have to a company or something like this, then we would ask you to leave Enable 2 at that stage. But there's no restriction on what you do once you have left. So.
Okay. Thank you so much. Again, if you have questions that come up later, you can still put them in the chat, and we address them during the panel discussion. And it's also true for the question that now came in from John Mulgrew. So John, I'll address it in the panel discussion later. We are going to move to the next speaker. Next speaker is Clive Mason, who used to be a partner in crime, or actually I should say is a partner in crime at the Beam Alliance. If I'm allowed to make one pitch for this group, is that the Beam Alliance, I think, is a very important organization to make sure that the field that we're working on is actually transformed into a field that is actually working for you as an entrepreneur. So, if you are not member of the board, the Beam Alliance, you're working on antimicrobial drug development or antimicrobial diagnostic development, become a member. If you're a small SME, then the membership fee is free. And it's very important that we can represent as many companies as possible. I think a lot of you have been waiting for the presentation from Clive. Clive is actually now heading the AMR program with LifeArc, and they launched a new program called PACE, which I think has a budget of 10 million. I was going to say US dollar, but I should say UK pounds. So a significant amount of money that just released the call. So Clive, we're anxious to hear more from you on the details.
Excellent, thanks Remco, and certainly endorse your recommendation on the Beam Alliance and the work that it does in this space and supporting SMEs and trying to change the ecosystem we're all operating in. I shall endeavour to share my slides. Okay. Is that coming through?
Yes.
Yes, it does. Yeah.
Excellent. Okay. So as Remco alluded to, I'm an employee of LifeArc, but today I'm here really to sort of highlight this new initiative that we launched a month ago around early translational support for antimicrobial therapeutic and diagnostic approaches in this space. So the overall fund initiative is 30 million UK pounds, and this is an initiative that's come together through a consortium of LifeArc, who I'm an employee of, but also Innovate UK and the Medicines Discovery Catapult. And this is a £30 million programme that's going to be effectively funding and support that's going to be deployed over a 5-year period. And I guess those that are not familiar with the consortium partners here, then effectively these are really 3 of the leaders in the UK health innovation and research community. And so they've come together to really harness their unique expertise and to try and catalyze and promote coordinated working across the AMR community and to accelerate the speed of innovation and try and mitigate some of the risks associated with AMR focused projects. And how are we going to do this? Well, we hope to sort of connect the ecosystems more and build partnerships and try and reduce and remove some of the barriers that exist in this landscape and ultimately strengthen the preclinical pipeline. We're going to invest in early phase antimicrobial and diagnostic projects, progressing them hopefully ready for downstream investment or acquisition by pharma companies as and when they regain interest in this therapeutic space. And we ultimately want to give the innovators in this area access to the funding they need to properly progress their projects, but also make sure we sort of supply wraparound support and advice to give the required expertise to really make sure the data packages that are being built to support their projects are fit for purpose and really sort of addressing any gaps in the understanding of their assets to make sure that they are sort of de-risked for further development. So that's the overall sort of fund and initiative. What is now open is the first funding call from within this initiative, and that's a £10 million antimicrobial funding call that is now open as of the 19th of October. And the first call is very much focused on early phase antimicrobials for treating high unmet need bacterial infections. And I guess what we're interested in here are the high threat pathogens that are on the WHO list and CDC list. So similar to what we've just heard around the enabled to, we're focusing on Enterobacteriaceae, particularly E. coli and Klebsiella pneumoniae, but then also Pseudomonas aeruginosa, Acinetobacter baumannii. And we do have, they are being prioritized, the gram-negatives, but there is also gram-positive drug-resistant Staph aureus is in scope, but as a lower priority compared to those gram-negative threats. And within this call, we anticipate funding 8 to 12 projects with up to £1 million per project and an anticipated 2-year duration. Obviously, within that 2-year process, there will be milestone-driven gating events that will dictate progression and procedure through that whole funding duration. This call is open to academics and researchers from SMEs as well, and this is a worldwide call, so there's no geographical restrictions within this. We're looking at the early translational space from hit validation through to lead optimization. And I guess one thing that is excluded is that sort of hit generation phase within this scope. So we're very much looking to something that has an antimicrobial activity and hopefully some SAR or some rationale behind the hits of the assets that are being progressed. We're open to all modalities across this space: direct acting, indirect acting, small molecule, biologics, peptides, antibodies. You know, that they're all potentially in scope. We want to really sort of try and foster as much innovation in this space, as much diversity of approaches in this space, because we kind of recognize that we need to increase the number of shots on goal that we're having to try and make sure that we have successful projects that come out of the other end. In support of this funding call, we held a webinar last week that gave a lot more detail on the process, what's in scope, how to apply. That webinar was recorded, and the stream for that is now available on the PACE website. So I recommend anyone that has an interest, has an asset that they think might be in scope, to go and visit that, review the information on there. On the website, there is also a lot of details on frequently asked questions that may also address immediate questions that you may have. And additionally, the next level for engagement within the PACE team is there's also an opportunity to book a meeting. So whereby you can actually schedule a call for a one-to-one call to discuss your asset, your project with the PACE team to understand how best to proceed through the application process. In the first instance, the application process is a simple expression of interest form, which I think is effectively a 2-pager. It's non-confidential, but that phase then will close at the 24th of November. So if you've got a project, get it in before that deadline closes. We will then triage those to then select the projects that then go forward to a full application, and that will run in Q1 of next year, with a view to notifying successful applicants for the end of Q2 next year. And then hopefully the funding can start to run through quickly after that. So as well as the funding, I think it's important also to mention, you know, we are trying to build a connected community. We want people engaged with that collaborative approach. We want to share best practices. We want to learn from bad practices or lessons learned to make sure they're sort of shared amongst the community. And we want to sort of build a much more connected community across the AMR infrastructure. So I think that sort of summarizes where we are. I'm sure there's a lot of questions. A lot of the information will be available on the website. I'm happy to take questions now today. There may be very specific things around particular projects that I may need to take away, or invite people to book one-to-one meetings to get the level of clarity they need. But that at a very top level is what we're trying to achieve within PACE. This first call is very much focused on therapeutic antimicrobial space. The anticipation is subsequent calls. We will look to see how we change that scope. We certainly want to bring in a diagnostic element within the PACE funding calls, so that will certainly feature in potentially the next funding call, which is anticipated to be next year.
Thank you, Clive. And indeed, there's one question in the chat which alludes a bit to what you just mentioned on a separate call for diagnostics. And the question is actually, if you have an antimicrobial product for which you anticipate the need for a companion diagnostic, is that eligible for this call or not?
I think, that's a really good question, and obviously that's a challenge that's recognized across this space as we get more and more selective antimicrobials, either restricted pathogen coverage, or some of them are very pathogen specific, to make sure that you have that diagnostic to run alongside to make sure you're treating the right infection with the right agent. In the first instance, that's not an assumption that we're making within these calls. These are relatively early assets. And I guess there will be a view as to how we progress those assets, as to where and when that diagnostic workflow needs to start feeding in to impact on that development path for those agents. But I think it's an important part, and I think it's something as a community we need to start thinking about how we better join that process up. Okay,
maybe in relation to that, we do have a few questions on the when next calls will be, but before we go there, a question from my colleague Leonie de Best at 5X. Would indirect acting immunomodulatory drugs be eligible? And I guess the same question is true for virulence factors and the other indirect mechanisms.
They certainly are in this call. They are certainly in scope, and we encourage people to bring forward those approaches.
So you can see that new funding mechanism creates a lot of excitement, a lot of questions. Like I was at the webinar, Another content-related question is: are you looking for a novel mechanism of actions, or also known mechanisms targeted by molecules with an improved efficacy profile?
Yeah, I think that's a really good point. We are looking for novelty here primarily, and that can be through a new mechanism, or a known target with a new binding motif, or a new chemotype. I think further evolutions of existing antibiotics or chemotypes are probably out of scope. So I think we're looking for something that has that sort of differentiation and novelty to come forward.
What is the duration of the grants that you typically will look at?
So I think at the moment they're limited to 2 years maximum. There may be a spread between things that maybe only run for a year rather than 2 years, but I think that'll be on a case-by-case basis as to what's needed to support the project, depending on what. There's also obviously the limit on the funding as to what stage they're at, as to how far that funding might get them at different phases of the process.
Yeah, and then the last question before we go to the last speaker is: do you have any sense when the next PACE calls will be released?
The next one is anticipated to be around about this time next year, I suspect.
Okay. Well, thank you so much again. If you think of other questions for Clive while we're already in the next presentation, and don't worry, you can still post your questions in the chat, and we address them during the panel discussion. On my screen, Aaron Duffy has already been put up by Doug. Aaron is the last speaker in the row. Aaron represents CARB-X, a funding mechanism that I've seen born and grow and has become, I think, the most important funding mechanism that we have at the moment globally. We talk about push funding and maybe even a bit beyond push funding for antimicrobial drug development. So looking forward to your review, Aaron, and also maybe a glance on, what to expect from CARB-X in the next few months.
Yeah, thank you very much. Thanks for including me in this today. And I have to say, I'm thrilled that PACE has finally launched. It's great to have another player in the space. So for those of you who don't know CARB-X, this is sort of CARB-X on a page, and I'll say more about our model in upcoming slides. But CARB-X was created in 2016, principally by the U.S. government, joined shortly thereafter by Wellcome. And then other governments, including the UK government, the German government, as well as the Gates Foundation, and very recently, Canada, the government of Canada. In CARB-X 1.0, which ran from 2016 to 2021, we were entrusted with $500 million to deploy to product developers in this space. In CARB-X 2.0, which commenced in 2022, we've been entrusted with a little more than $400 million to do the same work. We focus across 3 pillars of therapeutics: all comers, direct acting, non-traditional as well, prevention, including but not limited to vaccines, and finally, rapid diagnostics. I'd like to say with diagnostics, the entire purpose of focusing on diagnostics is in fact to aid our treatment portfolio in both the conduct of clinical trials and then the uptake of the product more rapidly to the market. Increasingly, we focus more on the performance characteristics that patients want. In our early days, we were in the all-comers mode of, if you have something that works against a priority pathogen, we'll see it. And while those remain important for us, we're really drilling down into performance characteristics as well. I think it's fair to say we've created a very healthy portfolio with some successes and hopefully a lot of success to come. In CARB-X 1.0, over 8 calls, we received just over 1,000 expressions of interest, not dissimilar to the style of expression of interest that Clive just described to you. Of those, we funded about 8% of those projects, so 92 in total. Today, from those 92, 28 remain active in the portfolio. In terms of success metrics, we have conducted or are conducting 13 first-in-human studies across the portfolio, and 5 diagnostics made it through to validation and verification, which is where we end for diagnostics. And then in advanced development today, there are 4 programs that are in phase 2 and beyond, and 2 of our diagnostics are on the market in Europe. So let's see. So what do we support? We support everything, if you think about treatment for a minute, everything from hit to lead through to a demonstration of safety in humans, and whether that's healthy humans or patients is very much dependent on the product. That is where we stop today. We've had some conversations about the merits of helping in that next step, which is proof of mechanism or proof of concept, particularly, for instance, for some non-traditional products, but that is not on the table today. In prevention, we focus on antigen or composition discovery, again, through to a demonstration of safety and immunogenicity in the case of vaccines in humans. And then finally, in diagnostics, we fund today feasibility through alpha prototype development, which includes validation on that alpha prototype. So how do we fund? Everything happens through an active funding call. In the first years, we conducted 8 individual funding calls, the first 4 of which can be classified as all comers. If you have something in the space of AMR that targets a priority pathogen, we want to know about it. The last 4, which were all conducted in 2019 and 20, were very thematic in nature. And this is because we were hoping to learn about some novel modalities and invest in more than one to help bring them forward. So the first call was for non-traditionals specifically, the second for vaccines and biotherapeutics, the third was a rapid diagnostics call, and then the final was a direct-acting small molecule gram-negative focus. We had a little bit of a gap while we were sorting out CARB-X 1.0 to 2.0. And so in October of last year, we launched an omnibus solicitation. Gotta tell you, I don't think we'll ever do that again. It was pretty ambitious, but it was 3 individual funding themes and then 3 cycles. The purpose of the 3 cycles was simple. We hadn't seen applications for 3 years, and so we really wanted to know what was out there. We published the cadence of cycles so that if a product developer wasn't ready for cycle 1, that product developer knew when cycle 2 was coming and cycle 3 was coming, hopefully to be able to build a package that would be responsive to the call. The 3 funding themes, again, more focused in nature. The first was a therapeutics call focused on oral therapeutics as the primary key, and then multiple target product profiles from there. Vaccines, this was a very specific call for vaccines against top etiologies for neonatal sepsis. Read that Klebsiella, E. coli, Staph aureus, and Acinetobacter. And the goal there was a demonstration that a vaccine could be made into a maternal vaccine, but also recognizing that product developers needed a commercial indication as well. And then finally, a cross-pillar call for gonorrhea. So we wanted to see novel therapeutics, vaccines, as well as rapid diagnostics, recognizing the need for those to go together. I should say that the first awards are just reading out now. If you follow us at all, you will have seen that our first award was announced a couple of weeks ago, and it's going to an innovative non-traditional program out of the University of Melbourne. And so if I didn't say it, we do fund both companies and academic or all nonprofits as well. Stages of the application. So we have an expression of interest. You can do it over a cup of coffee. It is non-confidential, and that is juried by the internal team simply for responsiveness. We then have a pretty fulsome project narrative to which successful applicants are invited. It's about a 20-page application, confidential in nature, to really understand what's in hand and the budget that would be associated therewith. That is juried by sub-teams of an external advisory board where the disciplines sort of represent the depth and the breadth of what is needed to move a program forward. Those who are invited to the next stage are asked to give a presentation to an advisory board. And here, this isn't a full program pitch, but rather specifically focused on key questions from the project narrative. And then finally, those programs that are recommended by the advisory board are evaluated and approved by the CARB-X Investment Committee. And then that is to enter negotiations to come into the portfolio. I wanted to say something very clearly here. The negotiations are only on the scientific work plan and the budget. There's really no wiggle room to negotiate the contract. Okay, one thing to say though, if you're kind of interested in interacting with us, but you don't seem to fit the funding call, or we're in a gap of funding calls as we are right now, we'd like to hear from you. Send a note here on our website under resources. You can see this here, to something called CARB-X Connect. Tell us a little bit about your program, and we'll engage either through written response or through a dialogue through Zoom. Some key features of the CARB-X contract. I want to say this is completely non-dilutive funding. It does require a cost share from the winning applicant. It's 15% presently for nonprofits and 30% for for-profit organizations. And we don't care where you get that cost share from, as long as it's not from the US government. We do fund in a stage-based way, meaning, for instance, we'll do a work plan on hit to lead. Once milestones are achieved and an evaluation of ongoing portfolio fit is done, then we can consider funding through the different stage gates, all the way again up to including a first-in-human demonstration. We are very proud of our support model, and I'm going to show you the sort of layers of that on the next slide. As Tim Jinks from Wellcome Trust would say, Tim doesn't need to give CARB-X money to give out his money. He does that better than we do. The goal is for us to give money, but then to supply support to these product developers. I imagine, like many of you, our typical product developer has about 5 to 10 at most FTEs, typically excellent at the foundational technology, really not very expert at drug discovery and development. And so we want to help them be successful. I should say that alongside a key component of CARB-X is stewardship and access. We believe in this very strongly. And so there are provisions in our contract. We have a guide for how and when to do this. It really doesn't kick in until just when you're starting your pivotal trials in phase 3. That'll be a happy day anyway. And the goal there is just to make available your product in regions that you might not be going into, but where they are needed. So it's not meant to mess with your commercial indications, but rather just to broaden access. Just to
Erin,
say,
will this be your last slide?
It will. So just to say,
Great.
multiple levels of support here from an in-house R&D team who are your liaisons to company support teams that we build from a subject matter expert pool of about 200 at this point. Aaron Zaytouni mentioned NIAID preclinical services. Let me tell you, this stuff works. It's been great for our product developers, particularly in areas of activity and efficacy. And we're very proud that we can tap into that. We have a whole program around portfolio acceleration tools, which ask questions for multiple product developers. We can talk about that some other time. We're just engaging in some market shaping activities. And finally, we have a business development council that helps our programs look for advanced development funding. That's our beautiful team. These are the people we support, and thank you.
Thank you so much, Erin, for a very clear overview. I think the one question that a lot of us are interested in is, if you look at your timetable, you have been very active with 8 calls in the first number of years, and now we have 3 years. We've released one single goal. Can you enlighten us a bit on what your anticipation is for 2024? What's going to happen?
Yeah, excellent question. So we kicked off about a month ago a refresh of our strategic review with a global panel of largely clinicians and some epidemiologists. And this is really to help inform us about how our investment priorities might and should change. That will complete here by mid-December. And the goal for us is to bring recommendations for a funding call or funding calls similar to the omnibus, though maybe not as ambitious in nature, to open up either late Q1 or early Q2 2024.
Okay, thank you so much. There's a question from Frederic Fassana, which I think you already answered. The question is, do you need a legal entity or footprint in the US to be eligible? I think you mentioned that's not the case, but let me phrase it a bit differently. Is it a plus for CARB-X to fund US entities?
Absolutely not. We are a global organization, and what we're working hard on is how to encourage applications from regions that we just don't have many applications from. And so anybody that can help us do that, we're happy to have that help.
And then there's a question that actually ask you to tell a bit, do you also fund here to lead programs, undiscovered libraries? So what is your support for the very early discovery work?
So we fund from hit to lead. So library screening is not, we would view that as upstream from us. So what we really want is a hit so sort of minimum stuff, hit molecule, demonstration of some antibacterial activity in some wild type strain. Doesn't have to be your ultimate target product profile, but we just want to know that there's a there. Some demonstration of mechanism, so you don't have to do the all singing and dancing, but some biochemical reason to believe that this molecule works in a way that isn't bleach. Some demonstration of the reproducibility of synthesis of the molecule and the purity, so that the molecule that you have is really the one that's active. And then finally, some direction of travel in terms of SAR. We don't require efficacy at that stage.
Okay. And then the last question before we go to the panel discussion is from Magdalena. She asked, are there other opportunities to engage with CARB-X beyond current funding? I'm not sure what is meant by that question. Maybe you do, Erin?
Again, we only fund through active funding calls, but as I mentioned, go to our website, hook up with CARB-X Connect, and you can tell us what what you have and ask some questions of us.
Yeah. Okay, Erin, thank you so much. So, Doug, if you can bring back the speakers overview like we have now, then we have another 15 minutes for a panel discussion, and maybe I should like to ask the panel a question that came via various attendees in the chat, and that has to do with the prioritization of oral, IV, local, and topical antimicrobials. Let me start to ask this question, beginning with Erin Duffy.
Yeah, so we're open to all modalities, but we did recognize that both the WHO clinical and preclinical pipelines, and even our own, are very not represented with oral therapeutics, and the value of those, of course, for access and also for step down out of the hospital is clear. So that's why we had the oral call, but depending on the infection type, we are open to all modalities, including topical modalities.
And Clive, is that the same for PACE, or is that different?
Yeah, in the current PACE funding call, then we are open to IV, oral, across the gram-negatives. But I think for the gram-positive, the Staph aureus programs, we are specifically trying to flesh out things that are more likely to satisfy an oral profile.
Okay, thank you. A question from Celso and Dobios he says, all speakers, and the question is relates to the starting point where Erin, I think, aligned us what you minimally need to have to be eligible for CARB-X. So the question is, what do you do with early hit discovery work? He says, unfortunately, hits don't come out of thin air. So is anybody here in the speaker group? Let me ask a question to Enable. For example, what is the position of Enable for very early discovery work?
Well, rather like CARB-X, we demand a hit as the minimum entry. It doesn't have to be something very active, doesn't have to have any in vivo activity at that stage, but we want a basic antimicrobial activity. We do, however, have a backup system within Sweden which will do hit discovery for people, but people have to make special applications to this. It's called a Science for Life laboratory. It's a national program. I'm not certain if it's open to people outside of Sweden, however. So unfortunately, we're hoping that somehow people have discovered something they think is a hit.
And Erin, how's that at NIH? Do you have any service delivery for hit screening?
Absolutely. So hit screening is certainly within scope of NIAID and DMID's grant portfolio. And so those applications would be within scope. It would probably likely fit within our R21 investigator-initiated application, but it could also fit within an R01. So I would encourage you to reach out to our program staff to discuss your project and see where you might find alignments. And as far as grants, I see there's also the question of eligibility within the HIT question. Mm-hmm. So for all of our funding announcements, there is an eligibility section to the funding announcement where you can see, and it will clearly state whether foreign institutions can apply or cannot apply. For our standing R01 and R21, foreign institutions can apply.
Yeah, and maybe in addition to this, I can bring some own experience. Sometimes there are national programs with national funders that allow for that early discovery work. So we have deliberately here invited the groups that work internationally and provide the international funding. But of course, there is always the national funding that would be eligible for these sorts of work as well in a lot of countries. Another question that I had, also a bit based on the remark from Enable that Enable in principle is not open for SMEs yet. You know, are the programs that we have, are they supported enough for SMEs, or is it still biased towards academics? And let me first give the floor to DMR from Enable to comment on that perhaps a bit more. When you think a program like Enable would also open to entrepreneurs and companies working on NMR problems.
Okay, I'm not certain I got the gist of your question here. What I could tell you is when we were running Enable, the IMI program, which was open to everybody, academics, SMEs, the great majority of applicants were SMEs, and the great majority that we took in and helped develop were SMEs. And so I definitely feel that the people active in the field, certainly beyond the hit to lead stage, are pretty much all at the SME stage. We're hoping that there's a large number of academics that would like to possibly transition into companies but need help to get started. And that's, you know, for practical reasons, we're focusing there. We think there's a need. They really have no idea how to develop a drug or what a drug should look like. And then we're, you know, as I say, for legal reasons, we're simply not allowed to give government money to private companies. But I'm not sure if this was your question.
Well, if I look at funding programs in the Netherlands, for example, they're also often biased towards academics. So sometimes I feel that apart from the other programs that we just heard and that are open for SMEs, there's still, I think, a drought within the funding landscape for entrepreneurs to actually access that early funding. And you know, at the Beam Alliance, we have done quite a bit of research on the preclinical development pipeline. The WHO has also, you know, made an inventory of which groups actually working on the early leads, and we see that over 80% is actually with SMEs. So, you know, I would certainly like to do a plea, although this is probably not the right audience, but to, you know, open those calls for SMEs as well. And so you know, hence the question to you. But thanks for your kind answer, and I hope that this will really change. Cassie, anything you would like to add here?
Yeah, I just kind of wanted to piggyback on what everyone's talking about, because I think this is kind of why we got added to this panel, right? There's a lot going on in these spaces, and there's a lot of smaller opportunities and different overlap. And I think, you know, certain companies can do this and you can do that, but you can't do this. And there's multiple different funding opportunities, multiple different agencies. And a lot of the services that we provide is to help you figure out what's, you know, there's 24 hours in a day. And a lot of the companies that are looking for this earlier stage funding don't necessarily have the time or the resources to hire a full-time person to do this, right? You need someone to give you a market landscape snapshot. This is what's going on. This is what it looks like. No, you shouldn't go over here because right now there isn't any funding, but you should call Erin so she understands what's there. And when they do have more funding and understand, you know, the landscape or analysis, sometimes you need a roadmap because there's so much out there. And that's a really good problem to have. The good problem is that we're starting to make waves in this area. The bad news is that it's not, you know, it's not one agency that has billions of dollars and it's very clear cut. It's a lot of agencies that have a lot of different initiatives. And sometimes that takes effort and time. And I think that's kind of the piece to this, is that we are so excited about being able to make waves in this industry and actually deliver products and make changes in a really neglected area. But there's just a lot. And so, you know, I think making sure that everyone on this call has my contact information and the other contact information of the people on this panel, so that when they do have questions, they can get pointed in the right direction. It's going to be a pathway. It's not a light switch. You don't call one of the errands and say, hey, we've got this product. And they're like, great, that's amazing. Here's a contract. Here's $5 million. Let us know when you're done. We wish it was that simple. It's just not. So make sure you get everyone's contact information, reach out with questions, and know that this is going to be what is that saying? It's a journey, not the destination. You will get there, but it starts with the first couple of steps.
It would be a very nice end of this webinar, a call to action to reach out to the speakers. I very much endorse that. I just post in the chat a comment. Any last questions from the audience to the panel? If you are shy to put something in the chat, you're also free to raise your hand if you like. So we're just looking out there to see whether there's anything unclear, anything you would like to know extra. Well, I think that everybody has provided a very clear explanation, Doug. So I get one comment from Will van Teuren. Thank you much for the discussion. From my perspective, this was really very useful, and I really enjoyed learning about the different funding opportunities. Doug, anything you would like to add?
No, really. I mean, I think a little bit building on what Cassidy said, and also seeing, we've got a couple of INCATE companies that enable too. We've got some people who've already spoken to Aaron at CARB-X before. We're hoping to see some INCATE companies with Clive. We've got people, at NIAID. This is everybody in this call will help you at some stage in your development properly. And some more people. So think about how you're building the portfolio of funding opportunities that will get you there. And I think that's sort of really the sort of thing. And I think also I was happy to hear both Clive and Aaron and others talk about, we're building an ecosystem together. So we will try as much as we can to work together and connect between the different programs. We've spoken about, and I think we will continue to think about this idea of Aaron's about, acceleration tools. What do they look like? That can be a service, or it can be some learnings and collaboration. So I think we'll definitely be thinking about that. I think it's great. I was unaware of CARB-X Connect. I think that's a fun mechanism. And I hope, give that a try would be my suggestion. And keep asking the questions and getting there, because I think not only can this group of people on this call give you some funding, they can give you some advice and move you in the right direction. So I think have conversations with these people, not just sort of hang around waiting for funding and then get disappointed when you didn't get the number. That funding process made you closer to getting the next thing, or maybe made you ready for PACE, even if you didn't get CARB-X. That's the way to think about this, I think.
So one question that came in over the chat was, will everybody go to Basel for the AMR meeting? And that brings us back to the pitch that you gave at the start of the meeting. And since we have 5 minutes left, Doug, just let's tell the audience a bit what they can expect in Basel. So I've been at the meeting, I think, since the 2nd episode. So this will be my, what will it be, 6th time or so. And I really enjoyed the meeting every single time, because it's such a nice mix between science and business. And often if you're at meetings, it's typically about, scientific findings. Yes, if you're in this field, there are certain mandatory meetings that you have to go to in order to be updated on what the state of the art is scientifically in the field. But there's only one single meeting where you also have discussions about the business aspects and how to improve the business aspects. And that's the yearly AMR meeting that now for the 2nd time will be held in Basel.
And I think the only thing I'd add to that is hoping this year to be not just about talking about business aspects, but let's actually share some of that learnings we've had. Let's talk about some of the successes we've had moving projects forward. We maybe can't have so much to talk about new products in market and billion-dollar deals, but let's talk about the work that's being done, with, at the early stage. What are we doing? How are we working? What's been going well? What can be improved? But so I'm looking forward to some good conversations and talking about success and sharing some successes. Let's not be too depressed when we meet in Basel. Like let's have a good time as well.
So you can meet all of us in Basel.
Yes.
Yep. Look forward to it.
Great.
Absolutely.
That's all from me. Any last questions? As I said, there will be a recording. We'll also have presentations to be shared. We'll put that up on our website, and we'll send you sort of a link to that via Eventbrite. So thank you very much for coming and being engaged. Apply also to the startup pitch at the AMR conference. That's another fun experience. And we're pretty open there. So it's not just INCATE companies. We want to see a variety of people. So happy to receive those applications, and we will have that call out very shortly. All right. Yeah, I think it's a couple of minutes of your life, and you can get 10,000 euros, which I think is almost the best value for money of all of these mechanisms. All right.
Thank
See you guys.
you.
Bye-bye.
Thank you.
Bye.